Ningamiti. Unless you plan on it. Don't be caught off guard. Okay? Just to be clear also, when it comes to basically making the decision of which contraceptive is best for you, that is your decision to make. I am simply there to just advise you on the type of contraceptives we have, just give you the pros and the cons, advantages and the disadvantages of the different methods. At the end of the day, the decision is yours. I am a strong advocate for patient rights and responsibility. I strongly, firmly believe in equipping our general population and mostly our clients and patients with information, enough information and clear and understandable information so that they are able to be in a situation where they can make decisions for themselves. Yes, I'm there to guide. Yes, I'm there to advise, but I'm not there to decide for you. Sanbonani, good evening. Absheni Lochani Habari. Bonoiti Tutubam. Welcome back to my channel. If you've never been here before, my name is Nobuntu G or Bububuntubam. This is a health segment. So again, if you're new to my channel, I am a qualified primary healthcare nurse clinician and a travel health practitioner. I currently work in a Center for Student Health and Wellness in one of South Africa's biggest universities. And I thought today let's do a health segment. Just a sit down chit chat video. It is July 2024. It's the first week of July and we are deep within winter in South Africa, Johannesburg. And so it's also recess, so it's a winter break in our university at the moment, and we've had an influx of patients coming in to start contraceptives prior to them visiting their homes. And there was a lot of misconceptions, a lot of questions that came up during those consultations that made me think, you know what, maybe I need to make a YouTube video, because these are probably concerns that more people have or questions more people have, and why not address them on a bigger platform like YouTube. Fair enough, my YouTube channel is fairly small and new, so I probably won't reach that many audience, but if I can just help one person, for me that would be more than enough. A disclaimer, this does not constitute as a consultation, okay? It's just health advice and education and promotion based on my expertise and experience. But should you have any health concerns, or should you want to start a contraceptive method after watching this video, I do strongly advise that you do consult with a qualified healthcare professional who will verify the information that you will receive from this video and also then start you on your preferred method. All right. So fair to say that prior to shooting this video, I wrestled with the idea of where to start, right? So I wanted to first plant seeds and then water them before we get into the reaping part. I wanted to first sow, but then I also didn't want to downgrade too much. I really want to meet my audience at their level. So I grappled and struggled and wrestled with the question of where to start. Must I start from the beginning of, what is a menstruation, or should I take it from what is a contraceptive? So based on what you're going to hear from today's video, please do comment in the comment section if you would rather I start there at the beginning, or was this relevant? Did it help? And what other questions or health topics would you want me to address? So because I am a female, I identify as a female, I wanted to really focus on female health, as this is the first video that I'm doing and hopefully the first of many. So I really wanted to just start with sexual reproductive health. I am aware that there are certain words I can't use on this platform. So I'm gonna try my level best to not use like certain words when I'm referring to the anatomy of a female and a man. Okay, and I hope you're just gonna follow with me and understand what I'm trying to say. Let's get started. And action. Just to paint a picture, I am going to pretend like we are in a consultation room and you are basically coming in for a contraceptive consultation. And just to give you an idea of what questions we ask and the reason why we ask those questions in determining which method is best for you. I don't want y'all getting pregnant if you're not planning on getting pregnant. You know what I mean? We'll talk about fertility in a different video for those of us who want to get pregnant. And I'm saying us because we are one, okay? But for those of us who are not yet planning on getting pregnant and maybe see ourselves being pregnant in the next 3 years or never, we need to be here. I think firstly, I just wanted to start off with what is a contraceptive. So basically a contraceptive is a form of a method that one uses in order to prevent an unwanted or unplanned pregnancy. Okay, there's different types of contraceptives. We have barrier contraceptives, we have non-hormonal contraceptives, we have short-term acting, long-term acting, and we also have hormonal contraceptives, right? So based off on how it works, the effects it has on your body, and the side effects and the adverse effects that one can expect from these types of contraceptives, this is where you now decide which one is best for you. You might have an identical twin, you might share the same DNA. It does not mean that the same type of contraceptive is going to work the same for both of you, right? It's very much individualized, which is why there has to be like a specific history. So just to give you an idea, yes, I work in a campus health clinic. I deal mostly with people from the age of 17. Sometimes I do find 16-year-olds, especially those who are doing first year, up until 60. Okay, so those are mostly staff members because we do cater to both students and staff members when it comes to contraceptives. So that's the age group that I'm dealing with. Mostly people by the age of 16 are already having their menses, or they're already having their period. They've already started by the time I come into contact with them. Okay, so I'm not dealing with 10-year-olds, 9-year-olds who have not yet experienced a period, which is why I'm starting from what contraceptives are there instead of me addressing the topic, what is a menstruation. Mostly young people are the ones that I consult, and some of them are already sexually active, others have not yet started, but they plan on being sexually active. So when someone does come for a contraceptive consultation, I should not assume, all right? It's not my job to assume that they are here to prevent unwanted pregnancy, because some of them are not yet sexually active. Some of them are not even planning on being sexually active. Some who are sexually active are not sexually active with male partners, but they are sexually active with same-sex partners. So they are not at a risk of falling pregnant, but still want to be on a contraceptive method for other reasons. What reason would one have to be on a contraceptive? So obviously the most obvious one is to prevent an unwanted pregnancy. One wants to be able to enjoy sexual intimacy without having to worry about the possibility of getting pregnant. The next question, if that's the reason, is to then ask, do you have any plans on getting pregnant in the next 3 years, in the next 5 years? Because you want to know whether you can advise this person on a more long-term contraceptive method instead of starting them on a short-acting contraceptive method. Another reason some people might come in for a contraceptive is because they hear about the effects that it might have on one's body. So some females experience very heavy and painful periods and might want to start a contraceptive because they potentially want to stop their periods, or they want to lighten their periods, or they've heard that there are contraceptives that help with painful periods, which I will get into later on in the video. So that could be the reason they're coming. So they're not yet sexually active, they're not even dating or thinking of it. They are here for school, but the painful periods are unbearable and they want to start something that will help them with that. We also have clients who come in for contraceptives or to start the pill specifically because they wanted to help with their acne. Okay, it might have been recommended by a general practitioner they've consulted before, or a dermatologist that they've seen before, who had said that if you go on the pill, it might help you with your acne, particularly if it's hormonal acne. Most of these clients, you'll find that they were on their parents' medical aid, or they've already been on a type of a pill like a Diane 35 or a years plus, but they were only on it for like 6 months, and then the script had to be renewed, but they were no longer able to afford purchasing it privately. So then they are coming to us, because we offer our services for free, coming to us hoping that we can continue the script or the prescription. So maybe this is where I need to mention that we do get our contraceptives from the Department of Health, so it is free of charge, and we do get the ones that the Department of Health offers, and Yes Plus and Diane are not part of that list. But we do have a combined oral contraceptive that's similar to those, that does have an effect on acne, but obviously the primary indication is not acne treatment, but rather a prevention of a pregnancy. That might be the other reason. Okay, someone is coming because they're not ready to get pregnant, or they're coming because they're hoping the pill or the contraceptive will have an effect, a positive effect on a problem that they are currently experiencing. Another reason that someone might go on a contraceptive is simply because they don't want to get their period. Yes, they just wanted to stop. Okay, like Auntie Anne, what do we call it? Auntie Flo, or going to Japan, or visiting Japan, or the little red ants. I don't know what you call your period, depending on what relationship you have with your period. But there are people who simply just don't want to go on their period. Like, they're okay with not going, you know? Tampons and sanitary pads are very expensive. We have female and male condoms that are offered for free in our country. You find them in public bathrooms, you find them in nightclubs, amataveni, anama condoms for free. But never ever ever will you ever find free sanitary pads and tampons. And yes, the struggle is real, and that is a topic for another day, but I just had to mention it on this video. So you do have clients who literally cannot afford to have a period every month. It's too expensive for them because they can't afford to buy sanitary pads. Trust me, it's true. Especially those who are unfortunate in a sense that their period goes up to 10 days. Okay? Because a period can go anywhere between 2 days to 10 days. On average, you know, the normal duration is like 5 days, 7 days. But then you do have people who extend and go up to 10 days. So imagine every single month being able to change your pad every 4 to 6 hours. Do you know what I mean? So there are people who simply just know that if I go on the injection, I've heard from my friends, I've seen on TikTok, I'm not going to get my period, and that's why I want to start contraceptives, you know? And so those then present you with an opportunity to then educate on, okay, I hear what you're saying, but are you aware these are the side effects? Do you know what I mean? And possibly then, if the need is sanitary pads, then that's where we try to come in to say, can we find a way then of providing you with sanitary pads? Is there a place that we can refer you where you can get your sanitary pads every month? If that's the only reason why you wanted to start the contraceptive, right? So you need to weigh the pros and the cons, okay? And then another reason that someone might come for a contraceptive would also be they have very irregular periods, right? So you have clients who go on their period once a year, twice a year, at most 3 times a year. So they go months on end not having their period, right? And this is when now you need to start establishing, is this a new problem? Has it always been that way? When did this start? When you do get your period, is it painful? How long does it last for? And so forth and so forth. Okay, so you also then need to do further investigations into the reason why, right? This is where something called the hormonal workup will be done, just to check your hormonal levels. Also, probably an ultrasound or a sonar to check if you don't have any ovaries in your cysts. This is where now most clients will be diagnosed with PCOS, which is polycystic ovarian syndrome. And this is now where one would need to also understand. I am a firm believer of always finding the cause of your illness before we treat it. Okay, so for example, if you come into my consultation room complaining of something different from contraceptives, let's say a headache, I am not quick to take out Panado and prescribe a Panado. We need to understand why you're having a headache. Is it because you're dehydrated? How much water do you drink daily? Is it because you're not sleeping enough? How much sleep are you getting uninterrupted every night? Are you currently stressed? Where is your headache? Is it frontal? Is it occipital? Is it like a tight band around your head? Is there any aggravating factors? What brings it on? What makes it better? Is it affecting your eyes? Are you having blurred vision? We check your blood pressure. Is your blood pressure elevated? We need to understand what is causing the headache before we can treat you, you know? So even with gynecological conditions, specifically someone who has not had their period in months and months and months, we exclude pregnancy if you are sexually active. Some are not yet sexually active, so pregnancy cannot be the reason. So we need to understand why, first and foremost. Okay, and then we can start treating you. We don't just give you the contraceptive pill so that you have a period every month, because also that's not a true period. Okay, yeah, so those are just the typical common reasons that someone would come in for contraceptives in my workplace specifically. Now let's move on to the types of contraceptives. We're going into the types of contraceptives to also remember your last normal period. So we need to be specific in terms of when was your last normal period, because you find people coming for contraceptive methods already suspecting that they are pregnant in hopes that taking a contraceptive method is gonna potentially terminate the baby they are possibly carrying, which is not how it works. Another type of a contraceptive would then be a combined oral contraceptive. This is the pill, and it comes in a form of a pill we call Nordet or a pill we call Trifacil. Nordet is also known as Oralcon. Trifacil is also known as Trigestrel. With the combined oral contraceptive, you might experience lighter periods, which is the reason why we also use this for people who are experiencing heavy periods. So people on the pill will complain about nausea, they'll complain about bloating,